Hello, I am Dr. J. Barnett. I am the host of the Just Heal with Dr. J podcast. And as you know, June is Men's Health Month. And I have a great opportunity to have Dr. Jafri here today. We're going to be discussing all things men's health. We're going to be talking about testosterone. We're going to be talking about erectile dysfunction. We're going to be talking about how to get men healthy, men battling depression. Dr. Jafri, we're going to be talking about everything, and he has an extensive background in working with men from all walks of life, ethnicities, and all different backgrounds. And I'm excited to have this conversation. And also, I want to thank Nuvance for powering this session between Dr. Jafri and I to have this discussion. And you're going to hear more about Nuvance and what they have to offer for men who are looking to become better. So, Dr. Jafri, man, this is an awesome opportunity, man. I want to say welcome to the Just Heal Hub. My podcast is for healing, to have deep introspective conversations, dialogue, depth, provide new perspectives and insights. So, if you could just introduce yourself, man, and tell us a little bit about your background and how you got started in medicine and internal medicine, as I know that you practice. And so, yeah, man, I'm excited about having this conversation with you.
All right, Dr. J, thank you so much. I want to please first thank you for having me on your show. Just to get started, I grew up in Connecticut in a Pakistani American family. I kind of was figuring out my niche. I was not sure, what was meant for me. I went to Syracuse for undergraduate. Initially, I loved math, so I thought engineering was it for me. Then, through some life experiences, my grandmother getting sick, I worked at an orphanage outside the country in Morocco. And I started thinking more about healthcare and the impact I can have. And I, introspectively looked at myself as a man, what could I do and what's the most benefit I can give the world? So I started pursuing a career in medicine. Initially I was, gung ho about pediatrics. I love kids. So I was like, that's my niche. That's where I belong. Then, through medical school, through rotations, through experiences, I started just loving the older population and connecting with different individuals, different women, men, people from all walks of life, different ethnicities, different backgrounds, people from East Asia, people from Africa, South America. I felt like I could just, kind of bridge that gap between different individuals from all parts of the world. So I ended up pursuing internal medicine at Barnett Hospital in New York. And that's where I completed my residency in the height of COVID. Of course, it was a bit difficult, but honestly, I wouldn't trade it for the world, and I love what I do.
Yeah, thank you, Dr. Joffrey, for sharing your unique background and just sharing how you got into pursuing wanting to practice and listen to you share about your grandmother. I was very close to my grandmother, who I felt was the best advocate that a grandchild could have. In fact, she nicknamed me Dr. J, and not knowing that she was predicting and having this prophetic sight to call me what I would become, earning a doctorate in healthcare administration and those things. And just to hear you speak about your grandmother, man, just really bring back memories and the similarities and the connection that we have from having grandmothers that have inspired our journey to what we would become. I want to start there. Your grandmother got sick. Was that the sort of nexus to how you began really taking a deeper dive and changing your career path from pursuing mathematics to pursuing medicine?
Yeah, definitely. I would say, she ended up having a stroke, so she was, paralyzed. My dad, grew up in a family, a lot of, families outside the US, they're pretty big usually. So my dad is one of eight with seven brothers. So it's a
Okay.
very man dominant family for the most part with one sister. And then my grandfather had passed away when I was maybe 6 or 7. So my grandmother was always someone I would look up to. She was always at the house. She would kind of teach me cultural things, because I grew up in Connecticut, not around many, people who were similar to myself. And to have that, comfort level, to have that person who was soft and caring, but also, with discipline. And, we had a lot of, men and little boys running around. So she knew, we had to listen to her. And when she got sick, it was kind of life changing for me because it was a person I had grown up and seen strength and, resilience from. And then someone who was kind of paralyzed at that point, and seeing, our family come together and just, surrounding her with love, that empathy within me kind of started shaping. And I felt like, I can really connect with different individuals, just like my grandmother was able to just bring our whole family together.
Right. And I love how you shared the empathy, because I think if a doctor doesn't have great bedside
Hmm.
manner, I don't care how much you
I
know.
agree.
I don't know if you are a empathetic and a very caring person beyond what you do from your practices. And so I love hearing that your heart of empathy started from your grandmother, man. So
Hmm.
I love that, and thank you for sharing that. So, but we're here today to talk about men.
Yeah.
So, and we're here to talk about men because, Dr. Joffrey, brothers have a difficult time with going to the doctor. And let's start there. Why do you think it's so difficult for most men to go to the doctor and seek out medical help when they're having physical issues? And what are some of the things that you have seen that have been deterrents for men not going?
Okay, definitely. So in my practice, I, mostly see men. I see men from 20s up till, 80s to 90s. But I would say majority of the demographic I see is, 20s to 50s for the most part. And there is this, lack of, I don't know if it's lack of trust or lack of understanding of their own bodies and their own health and well-being, that, hey, I'm okay. I'll tough it out. I'll be fine. I'll get through it. It's just a nick, or it's just, it's just a little bit of chest pain, or, oh, I just have a little bit of a headache, when you're masking, reality, which is could be a heart attack, could be a stroke. And, these are situations where I try to bridge the gap, and I try to, tell them, like, hey, give them that reassurance that you're right to come in. Like, it's good that you came into the office. It's good that you got checked out. It's good that you're following your cholesterol levels and your blood pressure, and, you're taking your health into your own hands. Because at the end of the day, you want to, of course, you want to be that provider or that person who, takes care of the family and does right by the family, but you have to be present and healthy and take care of yourself first before anything else. I have countless examples in the office of different people from different backgrounds. A patient can be from Ghana, can be from, Vietnam, from China. It's kind of a similar, viewpoint for men's health, where they say, hey, I'm okay. I'll be fine. Like, I'll figure it out. I see it with my, people in the men in my life, my father or my uncles. It's kind of a similar, outlook on the world, is that we'll be okay. We'll just power through.
Yeah, and which brings me to this question: which race of men and demographic of men, and it may be across the board, do
Mhm.
you feel that there is a demographic or race of men that are more open and more, I guess, connected to their bodies, to understanding that if there's a chest pain, I'm going to the doctor. I'm not taking Tylenol for a headache that's lasted a week.
Yes.
Have you seen a certain race that are a bit more open, and what races do you feel are a bit more resistance, if you have seen, or are most men connected to the same stoic perspective that I'll be all right?
Yeah, definitely. So I will say, like, you know, I did some trips in the Caribbean, so I've worked with some, more Caribbean individuals, and I've noticed when I would work over there that they were kind of followed the same mindset of, hey, we'll power through. And in America, I do feel like people kind of, they take their health a little bit more seriously. I think there's so much information out there of, this is bad for you. This, you can't eat this. You can't do too much of this. this is not good for you. So I do think, the 20s to 30s demographic has started coming in to the office a bit more than I would have expected.
Okay.
So that's an interesting factor. But I do think there's different demographics who may have not been treated well by the healthcare system, in
Right.
their
Right.
40s or 30s, or during that time, where there's distrust. Why should I get a vaccine? Like, what is that going to do for me? Are you sure they're not just testing me for something else, or whatever it might be? But for the most part, I do get a mixed demographic because of where I work. It's largely urban. So I get African Americans, I get Hispanics, and I'm close to New York City, so that helps in terms of any patients that gravitate away from New York City. So I'll see, people from Africa or people from East Asia, who come into the office.
Yo, and I'm just gonna break the ice. I'm a black man who grew up in the South. We don't trust the healthcare system.
Mhm.
And we don't trust the healthcare system because the lack of trust that was broken and created through how we were handled, right? When we think about the Tuskegee
Yeah.
Project, right? And we think about those men who were sort of, in a way, kind of manipulated a bit and kind of pulled into this study and not knowing that they would be injected with this we would call it a STI
Yeah.
today, right? They're no longer using the term STDs. And it took a long time for me to really develop trust with going back to the doctor. And because I had a father who was sick growing up, who was always in the doctor, or should I say, always in the hospital, that kind of created just a little bit of comfort because the more that he was going, he was feeling better. My father had a blood clot on his brain,
Mm.
and this blood clot brain caused some hemorrhaging. He had a sister and a niece die from an aneurysm. So my father has, for the majority of his life, sort of struggled with issues surrounding his head, brain, having headaches that would last days and often go into the weeks. And partially because of when they went into his skull to remove the blood clot, they hit a part of his nerve that paralyzed him.
Oh.
But trying to remove the blood clot, also once things began to heal, he had a lot of scar tissue. So he's been in and out of the hospital most of my life. So seeing him go to the doctor, going for checkups, that kind of brought a little comfort to me. But then when I started aging, I've had to reshape my view of just going to the doctor and really look at it not just from the lens of what we have experienced historically as African Americans, but I needed to develop my own relationship. And what I realized, and I often tell a lot of brothers when they're seeking a PCP, is to really look for someone that you can develop a relationship with,
Definitely.
because whether it's your doctor, whether it's your banker, whether it's your CPA, whether it's your trainer, or whoever that individual is that serve you in whatever capacity, there has to be a relationship. And it wasn't until I met Dr. Jill, who is my PCP, for the first time, Dr. Jafri, I felt that a doctor cared about me as a person. How important, can you speak to that? How important is it for doctors to show a level of care for individuals and for those that are from communities, particularly from the African American community, who don't trust doctors?
Mhm.
And most of us would know that we need to see one.
Yeah, definitely, Dr. J. Like, you hit it on the head. Building rapport is everything. Building that connection with a patient, that first 5 to 10 seconds, having that small talk. I know some people don't like small talk, but it's important. It's important to kind of have that relationship with people, because you're a stranger, or I'm a stranger to them, and I'm basically telling them, oh, they have this or this. And that conversation might come up down the road. So they have to feel comfortable with me, just like as if it was a friend. So that's what I aim for, and that's what I strive for with every patient I see. This regardless of which community they come from, but especially important if I feel like, this might be lost to follow up. Like, they might not come back. they've had horrible experiences with doctors in the past, and they don't trust the healthcare system. They feel like, no one is really helping them or hearing them or listening to them. So those few extra minutes, they mean the world, and they really, enforce that relationship you're trying to develop with people. I had a patient, not too long ago who was really, not about doctors. He didn't trust them. He had really high blood pressure. He just always had, blood pressure through the roof. But he was very, focused on his eating habits and eating a lot of bacon. He would have a lot of bacon every morning, a full tray. And, this is, his outlook was that this is okay for me. So I had to kind of talk to him and explain to him, what was happening, the high salt content, what it was doing to his blood pressure, and what the next step should be, and that I'm with him in it, and I'm going to explain everything. If there's follow-up appointments with a cardiologist, if he needs to go down a further route, I'm here for him. I'm going to explain everything as well as I can to him and simplify it as best as I can. And I think, that's just one example, but I try to develop these relationships and make connections. Even if it's a small thing, like if I see someone, I'm a huge Knicks fan, so if someone's wearing a Knicks jersey, or a Knicks hat or something like that, I'm just going to talk about sports, or, a football jersey or whatever it is.
Yeah. So what I'm hearing from you is you sort of find touch points that connect you to the patient, and as a therapist and as a clinician, that is something that I learned early on because I had the understanding, and particularly when I started working in healthcare, is when you're working in a macro system, it's important that you understand how to connect to people. One of the things that I did in my practicum and in my intern phase is I connected with all races of people. I spent time with Hispanics and Latinos. I spent time with the Asian and Indian communities. I spent time with the Lebanese individuals. I was working in Houston, so Houston is a melting pot where you have all different races and ethnicities and cultures and different backgrounds. And man, it was so beneficial to what I was going to do from a perspective of providing therapy because I may not know culturally what your practices are, but if I have a understanding of what you value in your culture, that's a touch point where we can connect. And I think that most doctors lack a lot of cultural competency. Can you speak about that aspect of it, and particularly when you're treating people who don't look like you?
Yeah, I mean, that's, I try to, I never kind of think about it, but you do kind of want to, understand their perspective and be in their shoes, right? You want to see the world the way they see the world, because that gives you a better understanding of the person they are, what they've been through, where they grew up, if they grew up in a war-torn country, if they, grew up in poverty, if they grew up in a very unsafe area. Where did my training? It's close to Newburgh, New York, which is was considered a very unsafe area and like murder capital of New York for some time. So I was doing my training there, and it was in the middle of COVID. So I would see different patients and people from all types of backgrounds, largely the Hispanic and African American community, and having the conversation with them about the fear of, hey, I have COVID right now, or my son has COVID. My son's only 35 years old, but he's in the ICU. Why is he so sick? Trying to explain these, having these tough, difficult conversations with families, and immersing myself within their own family culture. There's regular, like, outside traditional culture, and then there's their own culture within the family. So trying to understand people to the fullest extent was always my goal, and it's always still like a learning process, right? As every day you learn something new. It's not something you're just going to get to an end point and be like, yeah, that's it. I figured it all out. That's never going
Right.
to be how it is.
Right, because when as you were talking and talking about working in that area that was a high crime rate and the murder capital, and when you think about social determinants and you think about the access to care, you think about the quality of education, right? You also think about economically, what is the environment like? Because
Yes.
when you have individuals that are coming out of an environment where they don't feel like the outside world care about the world that they live in within their neighborhood, those people are not encouraged, or they don't feel that going to a doctor and seeking help benefits them because they feel that no one cares. And what I love about what you're sharing is that for you, there is an element of care that you express and display when you're connecting with these individuals, and particularly for men. Because if we're going to get men to start taking better care of themselves, I often say we have to show men what care looks like.
Mhm.
And you can only show men what care looks like through the experience that they're having with their doctors, that they're having with their therapists, that they're having with the people in the community. Because once we have, and I can speak from being a former athlete, when I've had an experience that was unpleasant, I was not inspired, encouraged, or motivated to try again.
Mhm.
And when we're talking about men, because we're losing men, Dr. Jafri, to suicide at such an alarming rate, uh, and the depression, the sadness, the loneliness. How important is it for men to take their health serious? Could you talk about that a little bit?
Yeah, definitely. I mean, it all kind of comes full circle and everything impacts each other, right? If you're a pretty sick individual, you have a lot of comorbidities, you're on like 6 to 8 medications and you're in your 40s or 50s, it's easy to get down on yourself. And, especially if you feel like no one's there for you, you might start thinking, what's the point of living? Like, why am I working so hard for what? If you don't have a family, if you don't have anyone around you, and it's just kind of trucking along, that's a very difficult situation to be in. And having a provider or having someone to hear you, like yourself, or even myself to a lesser extent, to discuss and have that discussion and those questions about mental health. And what are you feeling today, how's everything, breaking that barrier, because that barrier, I mean, you know better than I do that it's probably very tough to break down and try to break through to that point of trying to understand that man and what's hurting him inside, and he's just suffering in silence. That's it's a difficult situation, and I try my best, even though I'm not trained in psychiatry or anything else. But I am a trained physician, and I should be able to have the discussions with people and kind of get to the bottom of it and try my best to help them the best way I can.
Yeah, and I think that psychology should definitely be a part of any physician as they are
Mhm.
learning and as they're practicing and as they're going to residency, because to truly understand how to connect with people that have a terminal illness, or someone that has a fear that, man, I'm coming in and I'm afraid of what I may find out. I think that takes a level of understanding beyond your study to
Mhm.
put yourself, as you said earlier, to put yourself in their shoes, and then also to see it from their world. Because if you have a man who is the provider, he's the protector, he's the hero of the family, he don't want to go to the doctor and hear bad news.
Mhm.
Because to hear bad news, meaning that I may not be here to protect, provide, and be the hero for my family. And I think having the level of understanding when it comes to the psychological process for any man, because whether you are the protector, provider, as a husband, as a father, as a brother, as a son, that's a weight that a lot of men carry that they don't speak about, because I feel like most men rather die not knowing than
Mhm.
to find out and then feel like I now have to face my fate. Do you believe that?
I definitely agree with that. I would say that most men would probably, succumb to that as well. It's unfortunate because, there are resources, there are possibilities to prevent things from getting further, especially with technology and the way medicine is nowadays. We're so much further advanced that it's possible to get treatment and to get better. But it's that mindset. It's that mindset that's not really
Yeah.
changing. And that's like falls on us, to have those discussions with them, for them to feel vulnerable but still strong. It's okay to be vulnerable. It's okay to let your guard down. And I think, that's a barrier that's difficult to break, but it is something I feel that we can work on.
Yeah.
Sorry about that.
So, doctor, I wanna change course for a moment. When I think about men, and I think about the social messaging that we receive as men, when you're watching ESPN and when you're watching any type of sporting event, I often say this in my talks with men that I don't know how much the world really thinks about our well-being, because when you look at the messaging that is pushed toward men, it's not a healthy messaging.
Mhm.
And I said you often see pills to enhance your performance in bedroom, or somebody who's trying to tell you how to get up on your parlay, which is gambling.
Mhm.
You don't see any messaging that promotes healthy outlets where, hey, man, you should start working out. Why? Working out is going to lower your cortisol levels. Working out is going to, you know what I mean, increase your testosterone. It's going to increase your energy level. And this could possibly minimize, depressions and levels of anxiety or any other type of mental health challenges. When you think about the messages that men are receiving, and particularly for this next generation, which is heavy into porn. And I think we talked about this on the call yesterday. And I've been reading studies where erectile dysfunction is happening younger and younger for men in their 20s that are having to get on medication. And then you see the messaging where a lot of these enhancement and performance pills are advertised and marketing to young men. How harmful is pornography and the messaging for the health of men long term?
I think it's extremely, extremely harmful. I think, it's a form of addiction. When you get into the amygdala and different parts of the brain, that center of our brain is starting to fixate on whatever it is, if it's gambling, if it's drug abuse, and now it's porn addiction, the way the world is now, and how available things are in the present day. It makes for a lot of cases of porn-induced ED or erectile dysfunction. And that's largely what we're going to start seeing. And I will say, I feel like I am seeing that in the office a bit more, where I see younger and younger men requesting, medications for performance. And, you turn on the TV, you see a commercial, you see an ad for all these different companies, and pushing kind of this agenda of, a happy partner, hey, I need this. Hey, this is how my life will be, because of, this medication. So now you're incorporating a medication, yes, it works in situations, but it also has side effects to itself. But you're not solving the underlying problem, which might be anxiety or, things not related to, that.
Yeah. And because, when I'm talking to a lot of men, I'm 43,
Mhm.
and when I'm talking to brothers who are 40 plus, and I'm hearing the stories, and then I'm talking to guys in their late 20s and 30s, and I'm hearing similar stories,
Mhm.
right? These guys can't perform, they can't get it up, it's
Mhm.
performance anxiety. And I'm often asking these men, what are their lifestyle like? And I don't think men, because going back to what we were saying early, when you have pushed this message of that you've got to be strong, you've got to perform well. And when you have a man that doesn't understand that his body will change, and when your body does change, if you don't have healthy practices, healthy disciplines, you could be doing some things that would exacerbate, effects that will impact not only your performance, but even your mental health.
Mhm.
Because you're seeing men fall into a deeper depression because let's talk about that part, what you just said, right? Okay, if I'm performing well, I have a happy partner. But if I'm not performing well, I don't have a happy partner. If my partner's not happy, my ego is bruised. If my ego is bruised, I don't want to tell the doctor that I'm having an issue. So I'm just going to go online and find a pill to try to fix it. It may give you a temporary fix, but what is the damage that it's doing permanently? And I think that we're not talking about this enough, particularly for young men who are. I was reading a case on Arizona State University, and they were talking about how the honey packs and all the different male enhancement performance. There's like these things are like flooding the campus.
Yes. Mhm.
These young guys are wanting to perform longer, and I'm saying, why do you have these issues in your 20s? So when you talk about that part of the brain that is getting fixated to this reward and this dopamine, can you talk about how dangerous? Because I want men to really hear the messaging that that you can share, and how dangerous this is for them mentally, and how it can impact their bodies long term.
Well, mentally, you're fixating on your porn addiction, and you might not see it as a problem initially, like maybe you're something you used as a in your teen years, and then as you get older it's kind of become habitual, and then you're desensitized at that point. Then it's difficult to maintain an erection, it's difficult to be aroused by your partner in some situations. So now you're looking for, what can I do to solve this problem? Because now my partner is not happy. So now you opt for the medication, and now you're on this medication that does have side effects, that can drop your blood pressure, that can put you in, dangerous situations depending on the individual, because everyone's bodies are different, everyone reacts differently, and you're going to be on this medication, and you might need it for every, session, or whichever, with your partner, and that can, lead to a healthy imbalance. I don't know, how the relationship dynamics always work, because I'm usually just seeing that patient and not, the patient and the partner. So I'm not there in that, in their house or having these conversations with them. So I'm not sure how their relationship is developing. I don't know if it's a strain. These are things that, can kind of affect them long term mentally. Is that, I'm as good as my performance. If I'm not performing, am I a man? And that's an unfortunate outlook to have. It's extremely, that could wear down on anyone. And if the foundation is broken, the house will fall down. And that's a huge, that's something I do discuss with my patients as well.
Man, that's a bar right there, Dr. Jafri. That foundation is broken,
The
the
house will fall
house
down.
will crumble,
Yeah.
man. I love that, man, and I truly, I'm truly grateful for our conversation and the dialogue. I know it's going to be great, for the men. I have some questions written down. I want to go to one of the questions. What is the latest and common issue that you're seeing amongst men in your office as it pertains to their health?
As it's related to their health, I will say it's largely weight related for the most part. And that can just kind of circle into, mental health issues. They can, go through different, routes of, hey, I got bariatric surgery done, I had a sleeve done, I'm still gaining weight, or I tried Ozempic, I tried Zepbound, Wegovy, I tried these different weight loss medications, and it's still not working, or there's obesity might be affecting their sleep apnea, they might be having sleep issues as well. So I do think it's largely weight related, that they do come in to see me, that hey, I tried everything, I tried this diet, I tried keto, I tried this and that diet, I tried intermittent fasting, just nothing is working. I limit myself kind of aggressively in terms of what I eat, but I still, my metabolism is my metabolism. And having this discussion with them about healthy eating habits, and unfortunately, food is very processed nowadays. You don't even know what you're consuming, if it's the appropriate calories written or the appropriate nutrition facts are on certain things. So it's hard as a physician to kind of go through these conversations and telling, them what they should eat when, sometimes their mood is related to what they eat, but you eat for the soul, you eat for your body. It is fuel. I try to tell them that, you can enjoy things, but in moderation. Control your portion sizes, control this. So these are a lot of the discussions I feel like I have on a daily basis.
Yeah. And I want to ask you this. Do you feel that these men are listening, Dr. Jafri?
I think it's not going to happen in one visit. I never thought, like, in one appointment, in one 30 to 15-minute appointment, I don't know if I can make that impact, but I can start bridging it and, having conversations and helping them understand, this body that you take and from your 20s into your 30s, like into your 40s, into your 50s, into your 60s, that's your body. You treat it how you would like, but at the end of the day, you want to put yourself in the best situation. If that's exercising, lifting, cardiovascular health, interval training, whichever, they kind of prefer, as long as you're consistent and disciplined, you will see results.
Yeah. So, there's a large majority of men that I know that are struggling with weight issues,
Hmm.
particularly men that are 35 plus. Testosterone levels begin to
Yep.
drop. When testosterone levels begin to drop, you see cortisol levels rise. You see depression. You see energy decrease. You see sexual arousal decrease. All of these different things. How important is it for men to understand their bodies as they're aging? We talk a lot about women entering into menopause, and I share a lot of this in my talks to try to give men some perspective that men go through a similar phase, which is
Mm.
called andropause. And I don't think it's talked about enough because, to your point, you're trying to take a pill or you're trying to change your eating habit,
Yes.
and you may not have a understanding of what your blood level is and your blood panel, and you need to have blood work done. I'm often telling men, Dr. Joffrey, go get your blood work done so you can know what your body is doing, man. How important is it? And please echo this. And you're the doctor, you're the
Yeah.
expert. Tell these brothers, man, go get their blood work done so they can have a better understanding of their bodies.
Yeah, definitely. I really noticed that people start asking for testosterone levels. Now I know it's Dr. J pushing it.
Yeah, yeah, because you need to know. And listen, I'm going to be,
It's important. I
I
agree.
yeah, personally, for 3 years, I struggled with weight issues,
Hmm.
and I was a pro athlete who never had any issues, but I was on a tour, traveling up and down on a plane, 3 years, 36 cities, and just my body, man, was just being destroyed.
Yeah.
And then I was in my doctoral program at the same time. And there were times that I would eat clean for months, nothing happened. And it wasn't until I went into the doctor and got my test levels checked, and they were super low.
Yeah.
And not knowing that my body was not only not working to its full capabilities, but the depression was also impacting the levels of cortisol and stress because I wasn't sleeping well. And if you don't sleep well, you don't train well.
Mhm.
So can you talk a little bit about that, because I feel like there are a lot of men that are afraid to admit that your body's not doing what it used to do, brother.
Yeah, I mean, surprisingly, I do have a lot of men who come in and they advocate for themselves. They are like, hey, I did my research, I read these studies, and some will print out the studies and have me look at them, and I'll look at the sample size and, the effects of different therapies and testosterone levels. And I
Mhm.
think it's extremely important. I do agree with you fully that, people should ask for these tests and people should, you know, be open and honest. But that's kind of goes back to our earlier point about having that trust, having that faith that, they'll be listened to and not dismissed. And hey, like, that my doctor doesn't really think or care anything about it, so it must be something else. I just might be down in the dumps, or, I might just have something going on, or, maybe it was a bad breakup or whatever, their idea might be, but it might be something underlying. It might be something of a little bit something that we can manage and treat and focus on diet, or if it's to a level, including therapy as well.
Yeah. So what I'm hearing you say is all of these things are fixable.
Yes.
And for the men that are watching that will come across this clip, I want to take this opportunity to say, brother, it's okay to
Mhm.
go to the doctor. It's okay that your body is not working the same, it's not performing the same. Because the reality of it is that this body will break down naturally. That's just
Mhm.
what it's going to do. And I think one of the things that Dr. Jafri said is hearing men advocate for themselves. Brother, if you don't advocate for yourself, who will?
Exactly.
And if you don't advocate for yourself, how can you get the help that you need? And so I just wanted to take that opportunity to encourage the men that will possibly come across this episode, this clip, to encourage you to take the road and the path to seeking a better life for you and a better quality of life. Because the reality of it is that we're not living well. We're living longer. Study shows that we're living longer as human beings, but our quality of life is not the best. We're making more money, but we don't have a better quality of life.
Mhm.
We're eating more food, and it's not the best ingredients, and the quality of the ingredients that is going into the food is not for a life that's conducive to maintaining an optimal level of health. So just wanted to take that opportunity to share that with the men that will come across this. Uh, this question, Dr. Joffrey, how do we get men into the doctor? If you could create a marketing campaign and you could develop some messaging and develop some visuals, develop some ads, what would that look like from your world? How would you get men into the doctor?
Honestly, I want them to think that, you want to develop into that strong man and that individual that they likely aspire to be. That person who's, breaking down doors and, providing for the family, putting dinner on the table. I want them to feel like they can be that man, and, taking care of their health is the initial initiative, having these discussions with a provider, talking about mental health, taking care of your full body emotionally, physically, you know, focusing on these aspects that this is how, I live a quality life. This is how, I become, that man that I want to be and I will be. And that motivation and that, strive, hopefully will end them up, either myself or yourself and, get them to the next steps.
Thank you, doctor. And my last question is, and I love what you shared about how to get these men to be the best version of themselves. And I love that because I think that is the message that men really need to hear.
Mhm,
I don't hear or see men having conversation about evolution
mhm,
and the evolution of them as a man. And I share this a lot in my talks that I run into a lot of men who have the Al Bundy syndrome. And most of their conversation, most of their reflections are who they were in the past.
mhm.
And many of them are stuck in their glory days. And I spent a lot of time challenging men to think beyond who they were and pushing them to think to the levels of who they want to become. And I think this conversation is so needed on so many levels. And I hope this conversation sparked many men to encourage them to not only go to the doctor, but see a therapist if you need one, see a coach, see somebody that can enhance your life. And what I believe that you're saying is going to the doctor is going to enhance your life to continue to do all the things that you do as that provider and that protector as a man. What words would you use to encourage a man who's afraid of going to the doctor? He's having a pain in his chest. I know countless of stories that men have had a pain, took some Tylenol, some ibuprofen, some Advil, some different medication, and they didn't wake up
Mhm.
because the pain was actually a heart attack. And we're seeing the numbers climb higher for heart disease because I believe that men are under a great level of stress and duress like we've never seen before. So, what message would you give to that man that is struggling to go get the checkup?
The main message is that you are not alone. You're not, I want their feelings to feel validated. I want them to be validated as a man. You coming in, it's not a sign of weakness. It's a sign of strength. It's a sign that, you're making the efforts to get better. Whichever it is, if, you have a clot in your leg or you have, chest pain or if you have headaches or blurry vision. Of course it's scary. Of course, you're going to think the worst naturally. You already have the stress on yourself at home. Maybe you have, rent payment or, you have a sick family member or someone you're taking care of, but you can't provide and be that man that you want to be if you're not at your best and if you're not okay. If you're pushing things off or you're not, I'll take care of that later. My blood pressure is not that high. It's okay. To dismiss it, it's dangerous, and I want you to be safe and I want everyone around and you and your life to be safe and taken care of. And I know that individual is kind of the person who's taking care of the family and, providing for their kids or providing for their partner or their parents or whoever. And I want you to be the best version of yourself, like we've been discussing. And honestly, it's tough, to have these conversations with them. But I do feel like, it's possible, and I think a lot of providers and physicians and, individuals in my place should, do the same thing and try to have these conversations and try to bridge that gap because it's really important and can save a life.
Thank you, Dr. Jafri, for sharing that heartfelt message and for giving us your time today. I want to also thank Nuvance for allowing us to have this profound, extensive conversation around men's health. Again, June is Men's Health Month. This is a month where we talk about the welfare, the well-being, and also how to enhance not only just the wellness of men, but the overall whole man. And when I say whole man, I'm talking about mental, emotional, physical, and spiritual. Because all of these elements of who we are as men determine how we show up in the world. And as you have heard Dr. Joffrey say, is that you're not alone. And I'm going to say that again. You're not the only man that is suffering from erectile dysfunction. You're not the only man that is suffering from high blood pressure, high cholesterol. You're not the only man that is suffering from trying to figure out who he wants to become because who he was is long gone. You're not by yourself, brother. And no matter where you are, I know it's not easy because we don't often run into a Dr. Joffrey, a doctor who has the compassion and has the openness to share and to connect with his clients. I mean, with his patients, and to be vulnerable himself to talk about what it means to truly be a whole and healthy man. So I hope that you take this opportunity to take in and to digest this information. Nuvance is doing an amazing job to create not only access to care, but they are also doing a great job to go after the men, to encourage men to be well. Because here's the thing, brothers, if we are not well, we cannot be well for our families. We cannot be well for our communities. We cannot be well for those that we love. And I want to challenge you that putting yourself first is actually the best thing that you could do. Most men throw themselves on the back burner. And what happens is when we fall, and the hero suffers, the entire family suffers. But if you take the cape off, to all of my men who feel like they're Superman, I listen, I get it. We all want to have that S on our chest because the reality of it is that everybody claps for Superman. No one claps for Clark Kent. so so I get it that we want to be the heroes, but to be the best hero is understanding what is it that you need as a man. And if you need to go to the doctor, if you need to go to a therapist, if you need to hire a trainer, hire a nutritionist, brother, do it. Do it. So again, I want to take this opportunity to say thank you, Dr. Jafri, for sharing with us your expertise, your knowledge, and taking out your time. And also thank you, Nuvance, for powering this conversation. You can find this conversation on Just Heal with Dr. J on YouTube, and it'll be there and it'll be housed there. You can follow Dr. Jafri if you have any socials that you would love to give the audience.
No, I try to stay off usually. So
Listen, Dr. Jaffe, listen, that's the best decision that you can
yeah,
make. Because, listen, your mental health would be
yeah,
compromised.
exactly, exactly.
No, so again, I am Dr. Jay Barnett, a mental health expert, licensed marriage and family therapist, the author of Just Heal Bro. To all of the men, I encourage you to go get that book. It is a amazing, powerful journey, a journal that is encouraging men to be open, is encouraging men to be vulnerable. And I truly believe that because we're not often vulnerable men, this has a lot to do with the internal illnesses that we are struggling with. And so I want to say, free yourself so you can be healthier and you can become the whole man that you need to be. And until next time, healing is a journey and wholeness is the destination.